Did you ever hear of patient empowerment in healthcare organizations? This video is going to discuss it in depth. My name is Al-Zadjali. From this presentation, individuals will be able to understand what patient empowerment is, its components, and why it's important to healthcare providers. They're also going to be able to understand the problems that patient empowerment goes through and some of their solutions. So I'm going to start off by defining patient empowerment. And it is the process in which patients understand their role, are given the knowledge and skills by their healthcare providers to perform a task in an environment that recognizes community and cultural differences and also encourages patient participation. It's made up of 4 components, and they are the understanding of the patient of his or her role, the acquisition by patients of sufficient knowledge to be able to engage with their healthcare provider, patient skills, and the presence of a facilitating environment. So the purpose behind this is to help patients develop self-awareness, self-care, and to promote the understanding that patients can be equal partners in their own healthcare decisions. So one thing that we all know is that healthcare evaluation relies on patient outcomes. It's really important for providers to consider external non-health outcomes to accurately rate the efficiency of healthcare delivery. When thinking about external non-health outcomes, 2 things come to my mind: patient satisfaction and patient engagement. So what this means is that patients are looking to their providers to give them better accessibility and knowledge to learn and understand the decisions that go into planning their care. It improves treatment, compliance, and adherence. So this means that patients end up getting healthy, and as a result, they're more satisfied with their care and they're more satisfied with their healthcare provider. Just like everything else, there are many problems with patient empowerment. The ones we're going to focus on are lack of knowledge and asymmetry of information. If you really think about it, these 2 actually go hand in hand. So while many patients do not have the necessary knowledge about specific illnesses that they may have, the physicians can provide them with that knowledge. Their role is to answer any questions that the patient might have and help them find reliable sources in which they can educate themselves. So looking on the chart on the right, it represents the percentage of physicians but also patients when it comes to answering 2 questions. First question being, compassionate care is very important to successful medical treatment. As you can see, the percentage of patients answering this question is very high. It's around, let's say, 85%. However, when asked about healthcare professionals exhibiting compassionate care, only 54% of patients stated that physicians do so. As you can see from the difference in percentages between the patients and the physicians, there is an asymmetry of information. A great way to try to minimize the gap in the lack of knowledge of patients is through patient portals, education content vendors, joint active community sites, and a reward system. So a patient portal provides access to health information and services that empowers patients to access and view their medical health information. An educational content vendor helps browse educational content to find the specific materials that they need and when they need them. It is really encouraged for patients to join active community sites, and that is because they want to promote ongoing communications between patients, and it's always good to talk to someone who's going through something similar. So communication between patients of similar situations is always a good thing. The reward system basically rewards patients who take ownership of their health by being educated and informed. On the other hand, when dealing with the asymmetry of information, here's what we can do. Physicians should try to help the individuals gain knowledge on their health conditions and treatments. They should always have a positive attitudes towards them also. Organizations could have sessions where they could build the patient's confidence in navigating the health system for treatment. They could also support and help the individual assert their needs and health priorities. Here is a real-life example where a hospital in Norway had implemented patient empowerment. So what they did was provide patients with pulse oximeters that could be used at home via tablet. Patients themselves could monitor their oximeter measurements. They could also meet with their healthcare providers when needed. And because of this, it saved a lot of time for the providers, but also a lot of money for the patients. Here is another situation in which nurses actually implemented patient empowerment, and more information can be found on the link provided. The learning objectives in this video were to know what patient empowerment is, its components, what are some of its problems, and what are some of its solutions. Thank you for watching.